Hello, everyone. My name is Noah Washington from the Atlanta Voice. I am sitting here with Dr. David Jones, Chief Medical Officer for Anthem Blue Cross Blue Shield. Good, sir. How are you doing today?
I'm well, thanks. How are you?
Blessed and highly favored, man.
Okay.
We both figured out we're Richmond boys.
That's right.
Wow.
Exciting.
Very exciting growing up. So we had a chance to connect a little bit, and we're just going to get into here and ask a few questions.
Great.
My first one is, we're here August going into September. It's back to school season.
That's right.
So tell us, why is this important and a busy time?
Yes. So this time of year, commonly referred to as back to school season. So busy time of year for everyone, children, adolescents, parents, of course, caregivers, and health system as well. The health system is always busy. This time of year puts a lot more strain and stress, especially around access to healthcare for children and adolescents, but it's a really exciting time of year. So just to give you a little context of my experience in healthcare, especially around the back to school season, I'm a board certified pediatrician, and I've been practicing here in Georgia for over 20 years. And also, my current role with Anthem, I identify opportunities to improve the systems of care that really can help improve access to care for children, adolescents, and adults alike. And so really, I'm going to approach this from both the direct patient care perspective, kind of sharing and understanding patient and members' experiences, what works well, what doesn't work well, and also what we do from a systems perspective to really sort of address those opportunities to make things better for members so we improve their outcomes and certainly improve their experience. So now with the back to school season, it's a big time of transition for everyone, children, adolescents at all grade levels. That includes going from grade school to middle school, then to high school, to college and universities, and then also those finishing college and universities and or embarking early on their career. So it's a period of a lot of transition and a lot of preparation and planning. So it's really dynamic time of year, busy time of year, and happy to talk more about that.
I love it. We're going to get into it. The follow-up to that is, as a doctor, what are the issues that doctors address for children and adolescents at various ages this time of year?
Yes. So in the back to school season in particular, we do this all year round, but especially this time of year. There's a lot of aspects of what we do from a medical perspective. It's easy to maybe categorize them into three areas. The first area is around prevention. The second area is really around preparedness. And the third category would be more about planning and readiness. And so at a high level, within the prevention space, there are kind of two categories that probably stick out the most to me and a really high priority. One is vaccinations, and the second is around safety. So vaccinations, I think it's important to emphasize how incredible and beneficial vaccinations and vaccination systems have been to improve healthcare and reduce disease burden across the world, and especially in the United States. It's been very successful. Incidentally, this time of year, there's a program called the Vaccines for Children, which started in 1994, so celebrating its 30th year. It is a wildly successful program that has really done a significant job in improving health for children and adolescents across the country in particular. And then from a safety perspective, I think that's an area that's probably underappreciated but really important is from a prevention perspective. We support children and adolescents from safety in home. A lot of children, there's a lot of home safety advice we give parents. There's gun safety that are issues, for all across the country. And there's issues around safety, around activities that should be fun, such as swimming. Understand that there's swimming safety we counsel on, safety around seatbelt and car seat use, helmet use, those types of things. So safety, vaccinations, two big categories within the prevention space. Within the preparedness sort of category, that's where we think about physicals, being seen by your clinician, and really around what we refer to as the pre-participation physical. It's really preparing them for certain sports, competitive sports, and we'll talk more details around that. And then the third area, the planning, and that really speaks to, it captures issues around learning and development, behavioral health issues, which are increasingly prevalent and important to address, and also social dynamics and social adjustment issues as well. So, and then also within the last piece around the planning, What's probably also underappreciated is that action planning. So fortunately, most children are fairly healthy for the most part, and if they're ill, they are resilient and get better. However, there are some children and adolescents that do have some chronic illnesses, such as asthma, and so as well as severe food allergies, things like that. And so it's really important that people in those categories, for example, have very clear action plans that identify what the issues are, what they should avoid if possible, what the early signs and symptoms are, how to treat it, if you're in the health, in the school system, and also who to call and when, those types of things. So action plans are really important to have, especially this time of year as people are transitioning through different parts of their educational experience.
I want to lock in on vaccinations, which you previously mentioned. What is your perspective on the benefits, risks, and impact of vaccinations on individuals?
So I love this question because there's a whole lot there. We can spend a whole separate a session on this alone. But so I think is really important to talk about. Let's start with the risks. So, let me back up a little bit. So let's start with emphasizing again the benefits of vaccines. So what vaccines have done is really reduce our exposure of really serious illnesses. There's some really serious vaccine preventable illnesses out there, and the vaccines have done a great job to reduce those. Vaccines and the vaccine programs are also maybe a victim of their own success in some ways, in the sense that they've been so effective that there's some really severe illnesses we used to see 20, 30 years ago that we don't see as much anymore, and some have been eradicated, which is a great thing. What that does is people forget how severe those illnesses are. It's almost like you have to prove it negative in some ways if you don't see it or experience it. And so it's really important to understand they're really valuable and really effective. So that's then also we talk about the risks. So I think it's important to think about vaccinations, or it's helpful to think about vaccinations from a risk-benefit perspective. We think about the risk of the illness that the vaccine is designed to prevent and the risk of the vaccine. So some of these illnesses, the risk of exposure can be high in certain times of your life in certain situations. And the risk of how severe the illness can be very high as well. People worry about the risk of the vaccines. The vaccines are extremely, extremely safe, and there's systems in place to identify their safety, ensure their safety before they go to market and also after they're in production. So I think it's important to really think, what are we trying to prevent? What are the risks of those things? And then what's the benefit of the vaccines? And just to give you a few specific examples around that, there's so many vaccines, I won't go into all of them. Let's say the HPV vaccination, for example. HPV stands for human papillomavirus. And HPV, very common virus. Everyone gets exposed to it at some point early in life. Everyone. It's not if, it's really when. There are different strains of HPV, and there are a few strains of those that are shown to actually can directly cause cancer, certain types of cancer, cervical cancer, oropharyngeal cancers, genitourinary cancers. So the HPV vaccine really has done a great job to reduce the incidence of those cancers, and this is in young adults as well. So that's a cancer prevention vaccine, that's hugely wonderful. And so that's a great benefit to the vaccine, very low risk. The second, we talked a little bit about this earlier, is think about meningitis. And so meningitis, for those who don't know, it is a very severe illness of your brain and brain tissue, and you can go from being fully healthy 1 minute and literally within 24 hours very ill, if not worse. And so, interestingly enough, adolescents and young adults are probably the ones who are highest at risk for that. And I'll just be very brief on this. The reasons for that, some of the vaccines children get early in life, they get good protection, and then it kind of drops in certain periods of time. And teenage years is one period for some of those vaccines. At the same time, teenagers, young adults are congregating together, socializing together a lot, which is great, but it's a perfect storm of being exposed to illnesses that are very transmissible, very infectious, and also having less protection at the same time. And so we see outbreaks of meningitis in high school and colleges because of that dynamic. And so it's really important to understand when that's a period of time where people think they're the healthiest, and they usually are, but there's a huge risk out there that you want to protect yourself from. And then the third one and last one I'll mention is about newborns. And you think about, there's something called whooping cough. I think everybody's heard of whooping cough or pertussis. It's important to remind people, some people think whooping cough is rare, you don't see it a lot. It is very, very common, very common and very contagious, and it's most common in young adults. And people don't realize many times they have pertussis or whooping cough, they don't even realize they have it because they don't have a severe cough and they're walking around for sometimes weeks before they realize they need to get something checked. The whole time they're very contagious. Young adults are also the ones who are likely to start growing families and have newborns at home. And children, infants who get exposed to whooping cough, it can be severe for them. So you imagine the idea of a young adult who may be not feeling that sick with a newborn at home, right, close to them. The newborn is just, high risk right there in that environment. So it's important to. So those are just examples of how having vaccines to protect ourselves from cancer or loved ones from severe illnesses can be really beneficial. And so those are a few examples I wanted to touch on. So.
No, definitely. I completely rate. As we were talking earlier, I caught bacterial meningitis when I was in high school at 15.
Mm-hmm.
Yeah, so speaking truth to power,
right.
Man, for sure. And so let's double down, right? What are the critical ages and timings of vaccinations?
Got it. Yeah, so this is a great question as well. So when we think about timing of vaccinations, it's important to think about the timing is really around effectiveness and maximizing the benefit of the vaccine you're receiving or administering. What I mean by that, timing could be, let's say, 3 areas. Timing is timing in your life where you're most susceptible to exposure and your immune system is weakened. Again, the newborn I just mentioned, that's one period. Timing can also be the interval between the vaccines. There's some vaccine series that are 3 or 4 in the series. The timing between those is really important. The reason being is that, let's say, for example, if your immune system is low like a newborn, and you're trying to protect a newborn from a certain illness, and their immune system has to be boosted to get to a certain level, right? So the first vaccine in the series gets you, let's say, 25%. The second one can get you to 50%, 75, and then 100. So you get to that threshold where you're fully protected. That said, if those vaccines are too close together, you give the first one and then the second one too soon, it will blunt the effect of the first one. So you don't get the full benefit of that vaccine series if they're clustered too close together. So that interval is really critical for ensuring the effectiveness and the benefit of the vaccines. And then the third area, there's certain ages where it's just important. You have to be a certain age at minimum to get them. And that's 1 year old and 4 years old. And so that being those around the chickenpox vaccine and the mumps, measles, rubella vaccine. And some of that is based upon once they're at a certain age, then the immune system that those vaccines stimulate have to be a little more mature. So they have to be with a few small caveats. 1 year old to get the first, and then 4 years for the second series. So the timing, those are some examples of how the timing is important for vaccination. Then there's others for adults, but that's a lot more. You can go into it another time. So yeah.
I want to pivot just a little bit. Talk about physicals, right? So what's the pre-participation physical? Why is it important? And what are the key elements to it?
Absolutely, yes. So the pre-participation physical, some people may view this as, hey, I'm going out for a sport, or and I need to get this form filled out, and it may seem like a check the box, but literally and theoretically a process that may seem like check the box. Yeah. It's a really important step in the sense that we're ensuring that children and adolescents are physically healthy enough to participate in competitive sports. Competitive sports, not contact sports, competitive sports of all type. And so, there's a few things we screen for and really do a really strict assessment for. One example I think everybody's aware of is cardiovascular health. Unfortunately, every year there's always some adolescents who have sudden cardiac death. We're doing our best in healthcare and the American Heart Association and other groups to really help reduce that and eliminate that as much as possible. So it's really important to ensure that children and adolescents, we screen them to make sure if they're going out for a certain competitive sport, and even if they've done it several years in their lives, they're healthy enough to do it safely. And so we examine, obviously look for high blood pressure, which high blood pressure in children and adolescents is increasing. Unfortunately, it's a reality. We need to screen that and identify it and manage that. Children can have heart murmurs. Many heart murmurs are benign, but if you didn't have a heart murmur and you have a new heart murmur, then that's something that needs to be further evaluated. Those are just 2 examples. So it's really important. And also family history. I want to make sure I mention that because people are probably experienced with a physical form, several questions the parents or the adolescent has to complete and the physician or clinician has to complete, sign off on. Those are really important. The history is actually the most important piece about what your symptoms are, or maybe if they're brought on by exercise or physical activity. Also, family history, as much as people know it, is really critical because that can be an important component if somebody may be potentially higher risk but may not have any symptoms. So those details are really important part of the pre-participation physical.
A lot of what you said, I believe, is linked to behavioral issues, right? What would you say? Could you speak to more on what we should know?
Absolutely. So again, when we're talking about helping and supporting people we really look at it from a holistic perspective, and that means, our approach at Anthem is around addressing people's needs through addressing their whole health, and that means improving their physical health, improving their behavioral health, improving or addressing any social drivers of health as well.
Yeah.
And so behavioral health issues are a huge component in healthcare, and particularly in adolescents, children and adolescents. We're seeing an increase in issues around anxiety, issues, increase in depression, a lot of stress management issues. There's a lot of socialization and social isolationism, unfortunately, that we see in healthcare in children and adolescents. So those are really critical to screen for, identify for, and also help ensure people have access to the resources that are available. And important to remind people that if behavioral health issues aren't identified and addressed, they can lead to or exacerbate physical health issues as well. So they're really connected. So it's really important to make sure we're identifying them and helping support them as much as possible.
Before we got on today, I was telling you my brother-in-law was the head of health equity up in Indianapolis. Shout out Daryl Lockett. So I have to ask, how do these evaluations impact health equity and healthy outcomes?
Yeah, so that's a great question. And health equity is such an important concept. It's important to share, and I think your brother-in-law will share this. Health equity is not a standalone initiative or focus. Health equity is really a lens all of us in healthcare should be looking at everything we do through. So, example, if you're in the health, a big health system, if you're at a health benefits company such as ours, if you're a provider, trying to look at all the different aspects of healthcare and where there's disparities and how to reduce those disparities. And so, some of the things we talked about here today, there's some disparities or inequities in there. There's disparities and inequities in access to healthcare for either healthcare when you're ill or particularly preventative healthcare. So we really want to do what we can to improve access there. There's inequities and disparities in vaccination rates for children and adults too. Again, the more we can help improve vaccination rates and reduce those disparities, the better health outcomes. We know that vaccination has really reduced disease burden and death for vaccine preventable diseases. So those are really very straightforward way to improve outcomes. Another piece that's underappreciated, but I think important to call out, one of the biggest, health equity is not just one category. There's a lot of different drivers or elements within health equity or social drivers of health. Medical financial burden is a huge driver in that. And so many of these preventive measures we talked about, access to healthcare, vaccination, prevention, safety issues, really help to keep people healthy, which also reduces the medical cost burden on them, as well as the health system overall. So overall, these things really help to reduce, improve health equity. And we really want, people to be able to focus on being well and staying well, as opposed to managing, some illness primarily.
My final question for you, sir, is what should business leaders know about why this matters to them?
Great question. So yes, I think we talked about this earlier. Healthcare is healthcare, and also there's business aspects to it as well, and they don't have to be mutually exclusive. I think it's just awareness. Now, we talked a lot about children and adolescents today, of course, which is important. That said, they don't live in a vacuum, right? Their health, physical health, behavioral health, impacts their caregivers as well, and vice versa. And those caregivers and parents as well are employees of different businesses, and businesses really know that it's important for their workforce to be as healthy as possible. They're the best resource for any business. And so the more businesses view healthcare not only through the lens of their employees, but also their families, it's really helpful, and also through how that impacts their community. So all these dynamics really show that, healthcare is really everyone's business.
Wow. Dr. Jones, having you here today has taught me how small the world really is. I want to thank you, sir, for coming on, and I look forward to us talking and chatting it up next time, sir. Is there anything you'd like to say before we head out?
Oh, no, thank you. I just want to say thank you for the opportunity. It's a pleasure talking with you, getting to meet you, and I look forward to doing it more in the future.
Thank you, sir. All right. Thank you, everybody. For more, tap in with us here at the Atlanta Voice.